Hi, I'm Tiffany Ford with Infirmary Health, and today we have with us Dr. Amy McCoy of Mobile Bay OBGYN, and we are going to talk about the Da Vinci robot and the benefits of having that type of surgery instead of traditional surgery. Dr. McCoy, what are some of the types of robotic procedures that we offer here at Mobile Infirmary?
Here at Mobile Infirmary, we have a wide range of surgeries that we offer with the robot. Of course, we do GYN surgery such as myomectomies and hysterectomies, as well as thoracic surgeries, mitral valve prolapse, prostate surgeries, nephrectomies, colon procedures, and oncology procedures. So we actually have a very wide range of procedures that are offered here.
What procedure do you perform the most with the robot?
Mostly we do hysterectomies and myomectomies being removing fibroids from the uterus.
And what are the benefits of a patient using Da Vinci robot for the surgery instead of traditional surgery?
Well, a lot of people say traditionally think of open hysterectomies. With an open hysterectomy, you have the large incision, so the incision itself has risk of getting infected, having a lot more blood loss. You also, the way we pack the bowel, you have a lot higher risk of having slow-moving bowels or having colon issues as well. So with the Da Vinci, we can see better because we can zoom in closer to the organs and the actual area that we're operating in. The patient doesn't have in the open incision, so you decrease that risk of wound infection, the bleeding and pain from the incision site. You also don't pack back the bowel or have a lot of retractors in there, so you don't have the risk of the nerve damage and the bowel issues that you can with open hysterectomy. So you stay one night as opposed to 2 to 3 nights in the hospital. They're getting back to work within a couple of weeks, having a lot less pain, a lot less blood loss, and all of those things.
Have you seen an increase in patients choosing the Da Vinci robot procedure?
We have people, are seeing commercials and reading about it and are coming in and actually asking about less invasive, procedures and less invasive surgeries. So we're getting an increase in people asking about it, yes.
What is the difference between a regular laparoscopic hysterectomy and the Da Vinci robot hysterectomy?
There are a couple differences. With the Da Vinci, we can do a larger uterus because we do have the ability to zoom around, and our instruments can move around a large uterus. Also, with traditional laparoscopic procedures, you're using instruments that are kind of like a stick, so you can't have the fine motor skills that you do. So with the Da Vinci, it actually moves as your hands move, so I can actually curve and sew with the instruments. So you get a really good cuff closure, and on those larger cases that are harder to visualize, you can see a lot better on those.
So in conclusion, if someone is interested in a Da Vinci robot surgery, what do they need to ask their physician?
Anytime you're going to have any type of surgical procedure performed, it's always great to know the different options on how the procedure can be performed and what type of procedures your doctor is comfortable with performing.
So we appreciate you tuning in with us today, and if you would like more information on which infirmary health physicians perform the robotic surgeries, you can go to infirmaryhealth.org. And thank you, Dr. McCoy. Do you have any last words?
I think it's always important when you're having a procedure done to try to have it done in the most minimally invasive way possible. That way you have a better recovery time and less risk. So the Da Vinci is a great way to do that, but that's just something to keep in mind when you're having any procedure done.
All right, thank you.